We are joined now by Dr. Hassoun, the infectious disease specialist at Huntsville Hospital.
Thanks again for being with us tonight, Dr. Hassoun.
Thank you, Dan.
Now, as we just mentioned, Huntsville City Schools and Madison County Schools are getting ready to head back to the classroom. Some Madison City School students already did that. Meanwhile, Madison County is averaging 44 new cases each day over the past week. So, in your opinion, is it safe for students to return right now?
So I still in the opinion we hope to see less cases, but I would encourage everyone, whoever is starting to go to school, the school themselves are going to need to make sure reduce occupancy, keeping physical distancing, masking, hand hygiene, and hopefully we can cut down. I'm really worried, now we putting student in school, and fall is coming soon in October where the weather change and the flu and other viral infection going to come up. We're going to need to see how that goes.
Dr. Hassoun, this week the American Academy of Pediatrics and the Children's Hospital Association said more than 500,000 children in the U.S. were diagnosed with the virus since the pandemic began. We also saw a recent 16% increase in child cases. We know children aren't at high of risk for severe cases, but how concerning is this with children heading back to school?
Yeah, so as expected, and it's been published now and known, kids can get infected as much as adults. They do have milder symptoms, but some of them, even though rare, but they can get sick. So I'm expecting we probably can see more transmission, and we've seen it already when they opened the school in other counties. We've seen it can get transmitted between the kids, but at the same time it get to teachers, and what we're not counting is really their families, their parents, the grandparents. We're not tracking when we open the schools, and that's definitely concerning there.
Now, the White House Coronavirus Task Force Coordinator, Dr. Deborah Brooks, said today, anyone who socialized closely with others over this past Labor Day holiday, especially without a mask, should get tested. So what are you hearing about how we did, and are you expecting another spike?
So the spike, then, it takes about 2 weeks or 10 to 14 days from the holiday time. So we're probably too soon to judge on that. We've hoped that people have used as much common sense to do for the physical distancing and masking. It's really going to be another week or 10 days till we figure out how this is going to go. To get everybody tested because they didn't do the physical distancing, at the moment we probably have some testing available, but it takes time to get these results. I really think they should watch for symptoms. They get informed if everybody been positive they get exposed to, so they quarantine and get to be tested sooner than later.
Dr. Hassoun, let's talk about a coronavirus vaccine. This week, pharmaceutical company AstraZeneca put its phase 3 clinical trials on hold after a person came down with an illness. And so how big of a setback is that in the search for a vaccine?
Well, and again, we've talked concerning vaccine safety and efficacy. So this is not surprising in the way of you're going to see this come up where they're going to need to hold the trial or put it on kind of pause till they know if that, what we call serious adverse event, is related to the vaccine or is it something else that that specific patient had. That can take a few weeks, but we want to know safety issues. So if this come up, it's definitely important to know. So on follow-up with it, whether this got published with the AstraZeneca one or other ones, I hope everybody going to be transparent about safety issues. So, the public will trust the vaccine.
Yeah. Well, along those lines, there's a lot of talk about that timeline for the vaccine. President Trump has said we can expect some good news soon. The CEO of Pfizer said he expects results by the end of next month. How important is it not to rush something like this?
It's very, very important not to rush in this because, we hope they're going to be enrolling thousands and thousands of patients rather than hundreds, because from the hundreds you might not get enough information data-wise as well as safety-wise. So I hope they're not going to rush into it and enrolling just only a few hundreds and give us data. Again, I hope they're going to send us more information rather than the FDA approve it as a EUA. We really want something that all physician, public can have access to it to make their own judgment and to make their own discussion group to know if this is useful, effective, and safe.
Two local groups, North Alabama Research and Medical Affiliated Research, were enrolling volunteers for the Pfizer trial. We know one issue that these trials are having all across the country really is not enough minority volunteers. Can you walk us through why it is important to test different races and ethnicities and what it could mean for these trials if they don't get enough minorities?
So in general, in any research studies, specifically drugs or vaccine, we want to enroll different races, different groups, different ages, female, male, because in each race there is certain type of genetics they have. They might react differently, or they might have side effect specific for them, or it could be efficacious or not as efficacious in compared to other group. So it's very important to have a whole groups involved in this. So when you make judgment on efficacy and safety, you're going to be able to make it wisely, and you know it included all different groups rather than just one group.
Dr. Hassoun, you mentioned this a moment ago. I want to revisit this, though. While we wait for a vaccine, health officials are concerned about this upcoming flu season during the pandemic, a 1-2 punch, as it were. What can we expect in the next few months with these two viruses at the same time?
Yeah, and I take it in two different paths. One path, if our community take the right way of prevention, masking, physical distancing, we probably going to be able to cut down on COVID as well as we can cut down on the flu and other respiratory viruses. The other path is if the community doesn't follow these guidelines, doesn't want to keep up with masking and other things, then it's going to be a major problem where you can see significant effect on the hospitals, where you can see ICUs and hospital will be full, really sick patients. And not only that, because you cannot differentiate easily between flu virus and the COVID till you get the results of the test, that can take 24, 48 hours, you're probably going to be confusing to public as well as healthcare professional. So it can be a disaster if you go to the second path.
We have a lot more to discuss with Dr. Hassoun, including the number of people hospitalized with the coronavirus across North Alabama.
Stay with us. You're watching WAAY 31 News at 6.